Obstetrician Dr. Michael Grady saw firsthand the dire conditions people are facing after spending nearly 5 weeks there in Rafah working on patients delivering emergency medical care. Thank you so much for joining us, Dr. Grady. I really appreciate your time. You were stationed there, as we said, for roughly 5 weeks. Give us some sense of what you see, what you experienced as you were trying to just do your job in these difficult circumstances.
Yeah, good morning. Yeah, it's just horrendous. Worse than you could imagine, worse than you can see on a film, because, you know, what you don't get on newsreels and on films are the background screaming. You don't get the smells. You don't get the dust. It's really an awful, awful situation.
Can you give us some sense of where you were and how you were operating? Were you inside tents? Were you inside the hospital? What are the conditions?
Yeah, so I work with the International Medical Corps, and in early January, we set up a field hospital sort of halfway between Khan Yunis and Rafah. They are, if you would, like a MASH unit. We had a series of tents that were connected to each other. There was an outpatient tent, there was an emergency room tent, then we had an inpatient tents that would hold like 50 people. And of course, we soon had to upscale that. We now have tents that will hold 140 people. We had operating rooms, intensive care. So it was very, very intense. And I've done this kind of work, you know, for many, many years. And this is the most intense situation that I've been in.
We were seeing some of your video that was taken there while you were trying to do your work inside tents with emergency medicine. I have to ask you, what was the availability of medical supplies? There's been a lot of talk about how there's just not enough food, not enough clean water, and especially medical supplies. What did you experience there? What did you see?
So if you just imagine how many people that we were seeing, you know, we thought maybe we would see 20 or 30 people a day in the emergency department and maybe 100 people a day in the outpatient department. Within days, we were seeing 2, 3, 4. Now we're seeing 600 patients a day in the outpatient department. And sometimes 30 people will show up from a mass casualty event in the emergency room at one time. And so now we're seeing well over 100 people a day through the emergency room. To put it in perspective, in 1 week, we gave out 20,000 Tylenol. So you can imagine what it takes to resupply that and in the efforts for resupply. So there's always a constant shortage of critical medicines. There's a constant shortage of pretty much every supply, but, you know, we make do with what we have.
You do what you have to do, and I know the people there have thanked you profusely for that. I do want to ask you about a move by the Israeli government saying that its military is planning an assault on Rafah. What is that going to mean? Because you talk about all these tents that are sort of put there to try to deal with emergency medicine. What's that going to mean if and when that assault happens?
You know, of course, I'm not a politician, I'm a doctor, but I can say that we will scale up. We will provide the care that we do, and continue to do it. You know, we're used to working in conflict zones. We've been doing this for 40 years, and we will do what we have to do.
Dr. Michael Grady, thank you so much for the work that you did there to try to save lives, and for taking the time out this morning to be with us.